Hello everybody. Today we are discussing augmentation mammoplasty. Breast hold a special place in the eyes of female. A very small breast will result in females feeling underconfident as they cannot attain figurative shape in whatever attire they wear. Though padded bra helps, but that does not provide the permanent solution to the problem. The solution, of course, lies only with a well-experienced plastic surgeon. Hello friends, I'm Dr Ashish Khare, Senior Consultant Plastic Surgeon practicing in Kalosa Aesthetics Clinic, Delhi and Gurgaon, and I am here to discuss a beautiful procedure called breast augmentation or the augmentation mammoplasty. It's a surgical procedure to increase the breast size. This is usually done through breast implants or sometimes fat which are placed under the breast tissue or chest muscle. It is one of the most popular cosmetic surgery across the globe and preferred by the young population. In this video, I will cover every aspect of breast augmentation and also detailing about the silicone implants. Do subscribe our channel for more plastic surgery videos and stay with us till end to see how silicone implants can change the body image of a female with small breasts and its procedures. Now let us see what are the indications of breast augmentation surgeries. Firstly, girls with naturally small breast. Females when one breast is smaller than the other, that is the asymmetrical breast. It can be done as an adjustment for a reduction in the size of your breast after pregnancy or weight loss. One of the important indication is the reconstruction of your breast after having breast surgery for cancer or other conditions. Last but not the least, it is also a confidence boosting surgery for those who want to improve their self-image or feeling more confident in a swimsuit. It should be remembered that the breast augmentation does not correct severely drooping breast. If you want your breast to look fuller and non-sagging, breast lift should be done along with a breast augmentation. Let us see what are the options for breast augmentation. It can be done via implants as well as the autologous fat transfer. In implants, we have the saline implants which are filled with sterile saline water. The amount varies according to the shape and firmness required. Saline implants are inserted empty and then filled with sterile salt water once they are in place. Saline implants are usually not preferred. The other option is the silicone implants. These are pre-filled with an elastic silicone gel. The gel feels and appears more natural, hence are more popular. These can be textured or smooth, but the smooth ones are usually used nowadays like this, which you can see. These gives a very natural, soft feel to the breast and a very pleasing contour to their shape. Currently, US FDA has approved saline breast implants for augmentation in women of 18 years and older, and silicone breast implants in women of 22 years and older, but both can be used at younger age for reconstructive purposes. The another option is autologous fat transfer. It's another popular method to augment breast and give volume to it. Fat from your own body is taken up, usually from the abdomen and the thighs, and then transferred to the breast. These do not act as foreign bodies. It has much more acceptance to the body and give natural enlargement. Once fat gets transferred to the breast tissue, it acts as fat of breast tissue, only with no innate memory. There is no maintenance or follow-up required in the long run. Fat sucking from the other part of the body may also cause reduction and contouring in that area. But this method may not be a good choice in some cases, and a surgeon may face challenges in the following situations. First of all that transfer fat does not always survive. 30% of the fat may get resolved, and hence surgeons should previously counsel the patient accordingly. A slight large amount of fat may be required to inject to get the desired contour, taking care of the absorption of the fat also. Sometimes 2 to 3 fat transfer surgeries may be required to get the desired shape and result. A very thin female may not have a large reservoir of fat anywhere in the body, so it is not possible to transfer fat in such cases. Well, fat transfer is not a recommendable method for females wanting massive enlargement of the breast. Now, how does a silicone implant looks like? I have one implant in my hand. It's a smooth silicone implant. It is filled with gel and soft to touch. Its consistency matches to that of the natural breast. Hence, once inside the breast, they give it a nice, beautiful, natural looking enlargement. They are inert and do not react with the body tissues. This makes it quite safe. The body forms a layer of protective capsule over this implant. These comes in various volume, sizes and projection according to the enlargement desired by the patient or the judgment of the doctor. The size of the implant is decided. Do these implants have any shelf life? I always tell my patients that these implants need to be replaced in 12 to 15 years depending on the manufacturer instructions and the company they choose. How to decide the size of the implant? There is basically 2 factors which play important part in decision of the size of the implant. Firstly, the largest diameter or the base diameter of each side. This gives the size number. Secondly, the amount of the projection desired or required. Whether the patient wants round or fuller one, mid-height one or the projecting height types. These are decided by the volume of the breast implants. Now, how is the procedure performed? Breast augmentation is a daycare procedure. That is, does not require an overnight stay in the hospital. It is done under general anesthesia. To insert the breast implant, a single small incision is made in one of the 3 places. I just want to say that there are 3 approaches by which we can insert an implant. In the crease under your breast, that is the inframammary crease, this is the most common incision and most commonly used. Other incision sites could be under your arms, that is an axillary approach, and around your nipples, that is the periareolar approach. After making an incision, the breast tissue is separated from the muscle and the connective tissue of your chest. We create a pocket. Usually it depends upon how the breast parenchyma is. So we decide which position the implant should be inserted, be it subfacial or submuscular. Once this is ascertained, the surgeon inserts the implant into the pocket and centers it behind your nipple. When the implant is in the place, the incision will be closed, typically with sutures and band. The procedure. Some soreness, bruising and swelling is likely for a few weeks after surgery. That is perfectly normal. Expect your scars to fade gradually over time, although they will disappear completely after some span of time. While you are healing, it might help to wear a compression bandage or a sports bra for extra support and positioning of the breast implant. If you don't have a physically demanding job, you might be able to return to work within a few days. Avoid strenuous activities, anything that could raise your pulse or blood pressure for at least 2 weeks post-surgery. When you are healing, remember that your breast will be sensitive to physical contact or jarring movements. Now let's see what are the likely complications. These are scar tissue that distorts the shape of the breast implant. That is a capsular contracture or minimal pain. Infection, sometimes it can happen. Changes in nipple and breast sensation, usually temporary and rarely implant leakage or rupture. The most common question which my patients ask, does breast augmentation can correct breast sagging also? Yes, I always answer them that a breast augmentation does correct moderate amount of breast sagging. But if the sagging is too much, it may require need of another procedure called as a breast lift or a mastopexy procedure along with the implant surgery. One of the most important concern which the patients ask me regarding breast cancer, does the implant causes breast cancer? So the answer to this is that earlier the texture implants have been associated with few cases of lymphoma in the breast. But these texture implants are no longer used nowadays. Silicone implants till now have not been associated with any case of lymphoma and are considered safe. Hence, patient need not fear its safety as these are now well studied and analyzed products. So many clinical studies have been conducted and these have emerged as a safe products to be used. Some important key points about the breast augmentation. Breast implant won't prevent your breast from sagging. To correct sagging breast, you might need a breast lift in addition to. Breast implants aren't guaranteed to last a lifetime. They can be safely used for 12 to 15 years. Implant rupture is a rare possibility. One should also note that the breast will continue to age after the augmentation procedure as well, and factors such as weight gain or weight loss, future pregnancy might further change the way your breasts look. Any of these issues might lead to additional surgery. For silicone implants, it is recommended that patients undergo periodic monitoring with a mammogram, ultrasound to screen for ruptures, which are rare. Another important point is that about the breastfeeding. Many females have a concern that whether they are able to lactate easily after pregnancy. Yes, they can definitely breastfeed the baby after the implant surgery. To conclude, breast implant surgery does go a long way in boosting your self-image and the confidence. But make sure you get it done from an experienced plastic surgeon only. Do not forget to subscribe our channel for more plastic surgery videos and press the bell icon for latest update and informations. And also log on to our website www.kalosaesthetics.com and kalosa.in for more information. If you like our video, do like and share it and subscribe. Thanks.